Okay, thank you so much for inviting me to speak here. I'm very happy to be here with all of you. Thanks for coming out on a Saturday to hear this presentation. So my focus is going to be very practical. We're going to talk about specific foods. We're going to talk a lot about nutrition and how you can figure out the best diet for your body type. So we're going to first begin by looking at my overall approach, which I call the Paleovedic approach. And at the center of this is the customized nutrient-dense paleo diet. And, sure, yeah. And so basically, this is something that we'll talk about why this makes sense for people to follow. And then we'll talk about how to customize it for your own body type. And the other parts that are going to be covered as well include detoxification, fasting, spices, and using Ayurveda. So the foundation of this is paleo. So you might ask, why paleo? So I'm just curious, with a show of hands, how many people have heard of the paleo diet? Okay, so very good. So most of you have. This is a pretty informed. You as well. Great. Okay. So this is a very informed audience. So paleo refers to the Paleolithic era, which is the millions of years where we lived as hunter-gatherers before agriculture started. And agriculture began relatively recently in human history, 10,000 years, whereas for millions of years we lived in this hunter-gatherer lifestyle. And so what did our ancestors eat for millions of years? And the reason this is important is because this is what determines all of our genes. And our genes determine what our best diet is, that we can eat. So our ancestors ate primarily plant foods. So sometimes you might hear paleo in the TV or newspaper, and you think of it as all meat, but that's absolutely not the case. I think paleo should be a plant-based diet because that's what our ancestors ate mostly, was these wild plant foods, leaves, roots, tubers, fruits, all those things. And so it should be a plant-based diet regardless of what you're eating. Now, another misconception about paleo is that it's very low carb, but actually that's not what the research says. The consumption of plants high in starch goes back hundreds of thousands of years, and even before agriculture. So for most of human history, carbohydrates were really the foundation of our diet, but they were healthy carbohydrates, not processed or the kind of refined carbs that you see often in stores. Also, beans and dal and legumes were consumed for a very long time. Some people in the paleo community think you have to exclude them, but I don't believe that's the case. I think they very much were part of the ancestral diet. And you can see in this slide some of the populations that consumed legumes over the millions of years. And one of the concerns about beans and legumes is that they do have something known as anti-nutrients, which if you're soaking the beans and legumes for at least 12 hours, that actually inactivates most of those anti-nutrients and makes it much more digestible. So in our traditional cooking, we typically soak the dal and beans overnight, and that accomplishes this effect of clearing out those anti-nutrients and making the food much more digestible. Another really big difference between our diet now and what our ancestors ate is the diversity of the plants. So when they've studied hunter-gatherer societies, there are still a few around the world today. They typically consume about 100 different plants every year. And every day, they might have at least 20 different vegetables and fruits. So how many people here are able to eat 20 different types of fruits and vegetables every day? Anybody? No, me neither. But so most people today eat, unfortunately, a much smaller subset of plants and vegetables. And we'll talk about why this is important in terms of the nutrients and phytochemicals that you're getting. So the key word that's in bold in this slide is nutrient dense. And so we're going to spend the next part of the presentation talking about nutrients and how you can get more nutrients out of your food. So by nutrients, we're going to focus on micronutrients, and there are two categories: vitamins and minerals, and phytochemicals. And so we're going to take them one by one. So vitamins and minerals. So you probably might think in this country, everybody's getting what they need in vitamins and minerals, so there's no problem with deficiency, right? Well, wrong, because research shows that more than 50% of people in this country are deficient in some of the key vitamins necessary for health, like vitamin A, vitamin D, vitamin B6, and also minerals like zinc, calcium, and magnesium. So the majority of the population actually is deficient in these key nutrients. And so second type of nutrient is the phytochemicals, and these are the plant-based chemicals and nutrients which we'll talk about. But going back into the vitamins and minerals, there's a real difference between the vitamins in foods and the vitamins in supplements. So the vitamins, when they're present in food, are actually pretty complex structures. They have enzymes and antioxidants and other factors. So if you think that having donuts that are fortified with vitamins would be really healthy, that's not the case, because it's very different what you get out of a whole food. So here's an illustration of the vitamin E complex. So like most vitamins, vitamin E is actually a complicated molecule. It's a complex of these 4 tocopherols and 4 tocotrienols. And when you have the vitamin E in a whole food, like some of the foods pictured here, like a papaya or almonds or olives, leafy greens, avocados, paprika also is a good source, and apricots. So all of these have vitamin E, and also all of these have the full vitamin E complex. So they have those 4 tocopherols and 4 tocotrienols. So you don't have to worry if you're just eating those whole foods, you're getting the full vitamin E. But what about if you went to the store and you wanted to get more vitamin E? Maybe you feel like your diet is not right. This is a label from a supplement that I got from CVS. This is what is sold as vitamin E. It's just one of those 8 components. So if you can see the fine print there, which says D-alpha tocopherol, either side, that is just one of those 8 components. And if you're taking really high doses of those individual components, it can actually do harm. There was a study from Johns Hopkins University which found that taking these high doses of vitamin E in a supplement form actually increased the risk of dying by about 10%. And whenever there's a research study that shows that something increases the risk of dying, you know that that's a very significant effect. And so that's why supplements, potentially, you have to be very careful, because taking high doses is not the same as getting the vitamins from food. And also, 2 major studies have shown that beta-carotene is another supplement which is like vitamin A. And in smokers who took vitamin A and beta-carotene, they actually had more lung cancer than smokers who didn't take that vitamin. So again, the beta-carotene supplement is not the same as vitamin A. So just wrapping up this discussion about supplements is that we really evolved to get our nutrients from food, mostly. And if you do want to find out, you can get testing through your doctor to diagnose deficiencies in nutrients and then do targeted supplements or vitamins. And with a lot of these vitamins that are listed here, there's kind of a Goldilocks area where you don't want too much and you don't want too little, because either end can cause harm. You have to have just enough. So with iron, for example, anemia is a very big problem, worldwide, but also too much iron can cause other problems. Same with calcium. So how many people have been following some of the news about calcium supplements possibly causing harm? Have people heard about this? Some people have. There's some research that too much calcium supplements can increase the risk of heart attack and kidney stones, other things. But of course, we need calcium for bones. Same, we talked about vitamins A and E. And vitamin D as well is maybe the most popular and hot vitamin right now. So how many people have, I'm just curious, have checked your vitamin D level with your doctor? Okay, wow, that's great. Well, I think that we have a very informed audience here because the majority of people in America are deficient in vitamin D and don't know about checking their level. We don't get enough sunlight these days compared to what we used to get. And sunlight is how the body makes vitamin D, primarily. So that wraps up the discussion about supplements. And now we're going to go to, so we finished talking about vitamins and minerals. The next part is phytochemicals. So this is the other key nutrient that we're missing in our diet today that we need to protect our health. And phytochemicals, basically, they were much higher in ancient fruits and vegetables. And our modern fruits and vegetables, they've been changed over the years to be much sweeter, much smaller, much larger, and less fibrous. And that has led to a loss of these phytochemicals. And there's actually about 40,000 different phytochemicals. So food is really complex, and whole food contains such a large number of different nutrients. So there was an interesting study that looked at apples, and there's about 8,000 different types of apples, and this study looked at 300 apples. So if you look at this picture, the wild apples, how apples used to be, are much closer to what's on the bottom of the picture. They were small, they looked like plums, they have a pretty long stalk, and then as you go up in the picture, you see the modern apples, and the much larger, sweet, etc. So what would you guess is the nutrient difference between the wild apple and the modern apple? So, of course, we know the wild apple had more nutrients, right? I mean, you guys know that by now. So here in this picture, we have on the right is the ginger gold apple, which is a regular supermarket apple, one of the top-selling apples. And on the left is one of the apples from Asia, from Nepal. So what is the percent nutrient difference between these two apples? Anybody want to shout out a number, like percentage more for the 45? No, higher than that? 300? No, higher than 300? 1,000? No, higher than 1,000. 2,000? No, it's higher. 5,000? No, higher than that. 20,000? No, it's actually 47,500. So this is a scientific fact that was found in this study. So basically, 1 ounce of this wild apple on the left has 475 times the number of phytochemicals as 1 ounce of the modern apple. So you can see, it's like we're comparing apples and oranges, now. They're not even apples because they're so different in the nutrients. And, in this country, we're very good at choosing the least nutritious options. And I'm not talking about fast food or, unhealthy food. I'm talking about fruits and vegetables, because the most popular ones, like iceberg lettuce, potatoes are 140 pounds per person per year in this country. And, half of that is in the form of French fries, so that's partly where the problem is. But these other, the most popular fruits and vegetables we eat are actually the most lacking in the nutrients. So we can't just tell people to go eat more fruits and vegetables, because if they go and buy the wrong kind, they're really not getting much nutrition. So that's what we've realized in medicine, is that we have to teach people about really exactly what to eat. So one tip to get more phytochemicals out of your fruits and vegetables is that the more deeply and intensely colored a plant is, the more phytonutrients it contains, because these bright colors reflect those phytochemical levels. So that's the idea behind eating the rainbow, eating a wide variety of colors and making sure that you're getting every day, different colors on your plate. So that's one simple tip. Another tip is that most of the plant's antioxidants are actually part of its defense mechanisms, and those are found in the skin and just below the surface of the plant, typically. So if you look at this picture with the avocado, you can see that right below the skin of the avocado, there's a area of flesh which is darker green, and that area actually has the highest level concentration of antioxidants in the the whole avocado. So just when you peel the avocado, make sure you scrape the flesh really well off of the skin. And this is a simple tip, but actually it makes sure that you get the most nutritious part of the avocado. And this applies to many, fruits and vegetables, apples as well. Most of the antioxidants are in the skin. So let's talk about lettuce. And I said earlier that iceberg lettuce was, very poor in nutrients. It's high in fiber. It's 85% water, so great source of water and fiber, but not much else. So does anyone know what this type of lettuce is on the right here? Romaine? Yeah, exactly. So romaine is actually a good alternative to iceberg lettuce. It has about 4 times the phytochemicals as iceberg lettuce, so definitely a better option for a leafy green. Here are some other options that are better than iceberg lettuce. So arugula on the left. So this is has a peppery sort of taste, and that reflects some of these beneficial phytochemicals. And then in the middle is radicchio, and on the right is loose leaf lettuce. So these are all much better options for you, for your for salads or for leafy green vegetables. Choose these rather than the iceberg lettuce. So next vegetable we're going to talk about is the #1 best-selling vegetable worldwide. So can anybody guess what that is? Potato? No. Eggplant? No. Broccoli? No. It's cabbage, actually. So cabbage is the #1 vegetable consumed in the world. And, green cabbage is okay as a nutrient source, but actually this red cabbage, I took a picture of this in my local supermarket, and this red cabbage has 6 times the antioxidants as a green cabbage. So it's a simple way to just swap out one type of cabbage for another, and you'll be getting a lot more of the beneficial phytochemicals. Okay, so cauliflower is actually an exception to the rule because the white cauliflower itself is very nutritious, although typically it's the more brightly colored vegetables that are the most, but cauliflower is an exception. Even though it's white, it's very nutritious, very rich in antioxidants. But the purple cauliflower is like the king of cauliflower. It has 3 times the number of phytochemicals and antioxidants. This is a picture from my local farmer's market where we try to get the purple cauliflower whenever we can. So we talked about potatoes being very popular in the US, and sweet potatoes actually are a better alternative. Even though they're sweeter, they have less of an effect on your blood sugar, meaning they're lower glycemic, so they're better for blood sugar, and much higher in antioxidants than regular potatoes as well. And between these 2 types of sweet potatoes pictured, which one would you guess would have more phytochemicals? Orange, yeah, exactly. Because the orange one does have more than the white one, but even the white sweet potato is better than the regular potatoes in terms of nutrition content. But for sweet potatoes, the most nutritious actually is the purple one. This is one that my daughter and I love to cook and seek out because it's hard to find. But when you find it, it's really delicious. On the left is the raw sweet potato, and then when it's cooked, it looks like that on the right. And it's really very delicious and highest antioxidant level among all types of potatoes and root vegetables. So next we're going to talk about garlic. And so garlic alone has over 100 different phytochemicals. But the main ingredient in garlic, if you're not preparing garlic correctly, you're actually missing out on most of the health benefits. Because the main ingredient, allicin, is actually made when 2 substances in garlic that are stored separately are mixed together. And then you have to wait 10 minutes for that allicin to be made by the enzyme in the garlic. So the correct way to use garlic is to crush or mince or mash it in some way, and then wait for 10 minutes. And after 10 minutes, actually the garlic it produces those beneficial nutrients, and then you can heat it and you won't lose them. So you can saute or fry the garlic and get all the health benefits. But the key thing is you don't want to cook garlic immediately after crushing, because then you'll get just the garlic flavor, but you won't have all of these, beneficial nutrients. And for information, all of the information I'm going through is in my book, so you don't feel like you have to remember everything. It's all documented there, so no need to take notes or anything. Okay, now we're going to talk about onions. So what is the most nutritious onion pictured in this slide? The leeks, no. Red onions, no. So it's actually the green onion or the scallion. And yeah, exactly. And that's because the scallions are actually closest to how the wild onions used to be. So they had a very small bulb. You can see at the bottom of the scallion, that's the bulb. And then the leaves are mostly used today, which are very nutritious. And the scallions or green onions actually have 120 times as many antioxidants as regular white onions. So even though they're not, very fancy, adding more green onions to your diet is a really good way to get much more of these beneficial phytochemicals. Okay, so with tomatoes, we know that lycopene is one of the main nutrients that's really beneficial in tomatoes. So in this slide, what is the best source of lycopene that's pictured here? Grape tomatoes, the orange one. No, it's actually the tomato sauce in the can. And this goes to the bigger question of, some vegetables are actually better for you cooked and some are better for you raw. And with tomatoes, actually cooking them makes them better for you because it changes the structure of the lycopene and makes it much more absorbable. So any type of tomato sauce or tomato paste is actually much more higher in lycopene than the raw tomato. But even, it doesn't mean you have to stop eating raw tomatoes. In terms of the raw tomatoes pictured, the smaller ones are more nutritious. So the cherry and the grape tomatoes, the smaller ones are more nutritious than the larger tomatoes pictured here. So that rule does still apply. The smaller ones are higher nutrients than the larger ones, but tomato is one of those vegetables that it's really better for you in nutrition than when cooked than raw. So, for example, broccoli is the opposite. It's actually better for you raw or lightly steamed than cooked. So, this is just wrapping up our discussion of fruits and vegetables because I want to get into the Ayurveda, piece. But I have an entire chapter in my book talking about the fruits and vegetables and whether they should be raw or cooked and which kinds to buy. But I just wanted to illustrate that these differences really add up, over time. And the phytochemicals are our main defense against disease. So making sure that you're getting as many as you can really will improve your overall health. So coming back to just the overview of my approach, the next area we're going to focus in is the Ayurvedic body type and how to personalize your diet according to those principles. So I want to illustrate a few cases from my practice because I think that's the best way to understand how to use Ayurveda, in your own life. And these were some patients that I saw in my clinic in San Francisco. So the first one was a 54-year-old nurse who was struggling with low energy, but her main issue was obesity. So she had gained about 30 pounds in over a few years. She was very lethargic and had tried everything to lose weight, but couldn't lose weight. And she was not able to even exercise, and she was already following this paleo diet. And her thyroid, the TSH, which is listed there, is a measure of thyroid function, which was basically inching up towards the abnormal range, but it wasn't at a point where conventional medicine would actually treat it. So all these numbers there are lab values, free T4, free T3. So she went to her internist, and the internist ran the blood work. And she said, I'm really tired. I can't lose weight. What do you think of my blood work? And the doctor told her, your levels don't qualify yet for a disease. They'll come back in 5 years. They'll be much worse, and then I can prescribe you a drug at that point. So she was really not happy with that because she didn't want to just wait for her numbers to get worse and wait for a medication. So she came to me to figure out how Ayurveda could help her lose weight. So we'll come back to her and talk about what was helpful. This was a second case, a software engineer, an Indian patient of mine here in the Silicon Valley with a digestive problem called ulcerative colitis, which is basically inflammation in the GI tract. And he had been following a very strict diet for 1 year. No grains, no dal, just mostly eggs and meat, vegetables, some dairy, fruits, and nuts. And he was on this medication known as mesalamine, and he was still having inflammation, so his gastroenterologist wanted to put him on Remicade, which is one of the common drugs for autoimmune disease. And he was better after taking out gluten, which is in like wheat and those type of things, but that only about 20% better and still having a lot of symptoms. So he wanted to see what I could help him with. And the final case is a woman with 3 children who was struggling with chronic migraines as well as constipation. And she'd been having the migraines every month for about 3 months and also had very severe constipation. And she was told by her doctors to drink lots of water, so she was drinking lots of iced water and having a lot of salads, trying to get more fiber. But that was only making her worse in terms of the constipation, and her migraine headache as well was very, very disabling. Every month she was getting it and missing work and really unhappy. So we'll talk about how we can apply Ayurveda to these 3 cases. And Ayurveda, the word comes from Sanskrit, Ayu meaning life and Veda meaning science. So Ayurveda is the science of life. And for me, I studied biochemistry initially at Harvard, and so I'm very much passionate about science. And I saw that Ayurveda as well is a very scientific system and really rigorous, and I really came to appreciate that scientific underpinning. And they really emphasize diet highly, as you see in this proverb, that when diet is wrong, medicine is of no use, and when diet is right, medicine is of no need. So they really emphasize if you can get the diet right, that's the great majority of the battle in terms of getting your health optimal. So Ayurveda is based on the 5 elements idea of the universe, which we'll see on the next slide. And they really believe that the body can heal itself, and so that the job of the doctor is helping the patient to heal themselves. And it emphasizes that every person is unique, and also the diet should be tailored to the local environment and the season. So you might hear now, eating local is kind of one of the main popular catchphrases, and Ayurveda was one of the first systems that really said, eat local all the time. So the 5 elements are space, air, fire, water, and earth, and they combine to form these 3 doshas, which are Vata, Pitta, and Kapha. And Vata you can think of as wind, Pitta is fire, and Kapha is earth. And these 3 doshas are responsible for all the functions of the body. And when these 3 doshas in the body are in balance, then you have health. And when they go out of balance, that's when you have disease, ultimately. So every person is born with a unique combination of Vata, Pitta, and Kapha. And that is what is called the Prakriti, or the body type. So that's determined at conception, basically, and that never changes. However, the current state of the doshas is always changing. Every day, there's different factors changing it, different diet, stress, exercise, lifestyle. So that's called the Vikruti. And if your doshas are balanced, that is what ultimately leads to health, and the imbalance is what leads to disease. So these doshas, when they're in balance, they have a lot of positive qualities and positive attributes. So it's not necessarily a bad thing. But the word dosha in Sanskrit, is literally translated as defect, and so it implies that there's a tendency for the dosha to get out of balance. And so keeping it in balance is the main strategy in Ayurveda to remain healthy. So the first dosha is Vata, and this is a picture of someone who's like a textbook Vata person, and Vata is the subtle energy that controls everything relating to movement. So just like wind, which is always moving, it has those qualities of wind, like light, cold, dry, and mobile. And it controls everything in the body associated with movement. So the beating of your heart, your breathing, the movement of your blood, nerve impulses. So everything movement related is controlled by Vata. Now the emotional correlation, Vata is associated with creativity and rapid thinking, artistic qualities. But if it gets out of balance, can lead to anxiety, fear, and restlessness. So those are the two sides of Vata from the emotional point of view. Next is Pitta, which is fire. And Pitta is the heat energy in the body that regulates metabolism, absorption, digestion, and regulating your temperature. And it also has the qualities of fire, so it's hot and sharp and penetrating. And Pitta is the main dosha regulated with digestion in the body and also controlling inflammation. So whenever there's inflammation in the body, usually Pitta is one of the doshas that's out of balance. And positively associated with insight and intelligence, but if it's out of balance, can lead to anger and irritability. And then finally, we have Kapha, which is the force that forms body structure and strength. So remember that Kapha is earth and water. So those are the heavy grounding elements here that are responsible for the structure in bones and joints, ligaments, the skin. And like earth, Kapha has all those same qualities. It's heavy, cool, slow, and damp. And in a positive way, associated with connection, love, and calmness, but negatively associated with attachment, depression, or sluggishness, inertia. And Ayurveda is very much a qualitative system, so it believes in balancing the qualities, and that leads to balancing the doshas. So you see in this table the qualities of each of the three doshas. So Vata being light, cold, and dry, and Pitta, as we talked about, hot, sharp, and penetrating, and Kapha is heavy, slow, and cold. So the three doshas tend to go in excess depending on which is your dominant dosha, and so the way to balance that out is having the opposite qualities in your diet, in your lifestyle, and in your daily routine. So health is established when the three doshas are restored to their original levels. So sometimes there's a misconception. People think, okay, there's three doshas, so I have to get 1/3 of each. 1/3 Vata, 1/3 Pitta, 1/3 Kapha. But no, that's not the goal. The goal is to return to your unique combination. So if your Prakriti, for example, is 60% Vata and 20% Pitta, 20% Kapha, for you, that is when you are balanced. You want to return to that original proportion, original combination of doshas. So you're not trying to get equal amounts of all three of the doshas. So every person has a different program then because you're trying to get back to your unique body type. And then what causes the dosha imbalance? Well, it's, of course, often genetic predisposition, but diet is probably the biggest factor. And there's stress, social isolation, which is one of the biggest problems right now in the country, poor diet, toxins in the environment, etc. And in Ayurveda, every disease is individualized and every treatment is individualized. So 10 people with asthma, might get 10 different treatments because not all asthma is the same. And it depends on their body type, depends on their doshas. So that's where the individualized aspect is very strong. So let's come back to those three cases that I told you guys about and illustrate how Ayurveda was used. So remember, the first person was a nurse with the obesity, struggling to lose weight, thyroid issue, very tired, lethargic, etc. So based on these symptoms, which dosha would you think is the main one that's out of balance, Kapha, yeah, exactly. So she was, from the Western medicine point of view, her case is called subclinical hypothyroidism because it's called subclinical, so there's no treatment in Western medicine. But in Ayurveda, we could treat her with a Kapha program. And so I put her on a Kapha reducing diet, which I outline in more detail in my book. But basically, it was trying to increase her Agni, because when Kapha becomes really high, the Agni, or the digestive fire, is very much weakened. So it's like if you have a fire, in the fireplace, and you throw like 10 logs on it, it's going to put out the fire because of the heaviness. So strengthening the Agni is like strengthening the metabolism, so that she begins to burn calories, burn fat, metabolize better. And so I also recommended changing in diet and using this one herb known as ashwagandha. And after 3 months, her thyroid numbers actually came back to normal. And she reported that she had lost about 20 pounds of weight. And she wasn't really trying to lose weight, but she was focusing on the Ayurvedic diet. And her energy was much better. And she began exercising. She had enough energy to exercise. And then she was able to lose the final 10 pounds over another few months. But basically, she was able to prevent this development of the disease, the hypothyroidism. And I think Ayurveda is really the strongest for prevention. So catching someone in the earliest stages before they've developed the disease and then preventing it, that's the mark of success for a true Ayurvedic or integrative practitioner. So the second case was the software engineer with the digestive problem, the ulcerative colitis. And you remember he was on the paleo diet, but still had a lot of inflammation and didn't want to take a stronger and stronger medications from his GI doctor. So, I was going to ask what dosha is involved here, but pitta, exactly. So, this patient very much was pitta excess because of the inflammation, bleeding, all of his symptoms. So I put him on a pitta pacifying diet. And his diet had a lot of very heating foods like meat and eggs and dairy. So I had him take out all those foods and put him on just a very cooling diet. So a lot of bitter vegetables, bitter greens, and a lot of salads, raw foods. He wasn't eating really too many salads. And I had him add in, much more turmeric into his diet because, we all use turmeric, of course, but it is incredibly powerful for inflammation, reducing pitta, and consuming it every day is, what I recommend. So at 3 months, he reported his digestion was starting to improve. He was having better, digestion, not as many symptoms. And it did take about 1 year, of working together because Ayurveda works slowly. It's not an overnight thing. But after a year of treatment with diet and other changes, he was able to just control his condition with diet and eventually get off of his medication. So he was very happy, and he didn't have to initiate the stronger and stronger drugs that his doctor was recommending. And that was by just addressing the pitta that was causing the inflammation, in his system. So we're almost done, and then we have some time for questions. So I'll just finish up with the presentation. The third case was the woman who has 3 children, but also the chronic migraine, headache, and the constipation. And she was struggling with the every month migraines, and was eating a lot of salads and having the iced water. So which dosha would you guess is involved here? Vata, yeah, exactly. It's the only one that's remaining. And so in her case, she had been drinking this iced water and eating salads because she was trying to improve her health, but that was actually making her worse because having the salads for her body type was actually a very bad idea. And also, iced water is a no-no in Ayurveda. Never recommending iced drinks or iced water for most people, especially Vata. And so in her case, I had her switch to a Vata pacifying diet, take out all the raw food, just focus on cooked food. So no more salad, no iced water, just warm foods, and also foods that are warm in quality. So not just temperature, but actually like energetically warming foods. That's what's best for Vata. And I had her incorporate more fat in her diet. So, here in this country, we're often very afraid of fat because we've been told to, eat low fat and avoid, too much fat. But the research is it's all about the type of fat. So if you have good fats, like the avocados, olive oil, ghee, and coconut oil, those are actually very beneficial. And I think that there's no downside with having those, too much. And then she reported that her constipation was resolved and the migraines reduced by about 50%. So just by balancing Vata, she was able to, make this change. So to determine your own body type, I have a questionnaire in my book, which is 20 items that evaluates these different qualities. And there's many questionnaires online, of different quality, but this one, I believe, helps with really determining your unique body type. And it does have individualized recommendations for prevention, based on your unique dosha. So just in concluding, I want to tell you about one thing that's good for detoxification, and that is the beet greens, which are the leafy tops of the beetroot. So this is a picture from my local supermarket where the leafy greens are still attached to the beets. So if you buy the beetroot with the greens still attached, they're the most fresh. And the greens are very good for detox. They help your liver. You can add them in, cook them. You won't lose the benefits. So definitely incorporate beet greens into your diet. And spices we all use every day, but very powerful for inflammation, improving digestion, and also helping with your blood sugar and metabolism. So they have a lot of benefits. So this is a picture of my daughter because I want to remind you that eating should be fun. And here she is eating a pomelo. And she always uses all of her senses and really appreciates food. So just remember that it should be fun and enjoyable to eat. So my book does have more recipes, and you can keep in touch with me through my website where I have a blog or on social media. So thank you so much for your attention today.
Thank you so much, Dr. Akil. And yes, Dr. Akil's books, The Paleovedic Diet, are outside at his table. So pursuant to the talks today, you can always go ahead and talk to Dr. Akil. He'll be here for a little bit. Yeah. So he can also talk to you one-on-one with regard to specific questions that you have.